Now coming to pre-bypass and during bypass period. During the pre-bypass period, you try to maintain the hemodynamic and metabolic stability so that the patient is ready to go on cardiopulmonary bypass. And the degree of surgical stimulation varies markedly in this pre-bypass period. But once patient goes into cardiopulmonary bypass, there is going to be activation of extrinsic and intrinsic coagulation pathway. Your platelet function is going to be altered and there is hemodilution, hypothermia and contact activation by the circuit material. The post-bypass, there can be hemodynamic instability. The hypotension can result from surgical or technical failure. For example, you are going to repair but still the repair is not satisfactory. You have closed the septal defect but still some amount of leak is there. Or it can be a right or left ventricular dysfunction and the inflammation can cause vasoplegic syndrome or there can be a left ventricular outflow obstruction. So, hemodynamic instability in the post-bypass period can be due to surgical or technical failure, your ventricular dysfunction, your vasoplegia or a left ventricular outflow tract obstruction. There can be dysarrhythmias in the postoperative period. Pulmonary complication includes atelectasis, bronchospasm, your mucus or blood pucking of the endotracheal tube. So, you have to do a proper suctioning. There can be pulmonary edema, particularly if your heart is poor. Hemothorax and pneumothorax also can happen. And there is an entity called pump lung, which might be an inflammatory activation and the lung might be injured. Metabolic disturbances includes hypokalemia, hyperkalemia, hypocalcemia, hypomagnesemia and hyperglycemia. And with pump, you are heparinized, there is going to be bleeding and coagulopathy also can set in. These are all the various factors you should remember in the post-bypass period.